DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, welcome to DocTalk. We're going to have a great show. We are in Lewis, Iowa. We're at J.W. Friend Farms. We're going to have a great day today. We're going to talk about cattle feeding. We're going to talk about Southwest Iowa. We're going to talk about the hospital systems here at feed yards and so much more. Welcome to the show and thanks for joining us.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cooperia, Nematodirus, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism. Then bite back at safeguardworks.com.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thompson and I'm here with my friends and colleagues here at J.W. Friend Farm in Lewis, Iowa, and the Friend family. And we have a great thing going. We have a great relationship. We work together with their cattle operation, and farming operation. Just a tremendous example of how to do things right, how to treat people right, and in our industry. And as you can see, we got everybody here today, and we're gonna do the introductions here. We're just gonna go around the table, but we've got John, we've got Frank, we've got Walt, we've got Vinny, we've got Kevin, we've got Adam, we've got Dan, JP, Matt, and Doug Friend. Today, we're going to talk about your operation. We're going to talk about some of the things that y'all have done in the hospital pen, which is just really, really cool stuff. So, y'all ready?
Yeah.
Awesome. Well, let's just start out. Let's learn a little bit about your operation.
Well, the feed yard was started with my dad and a brother in the late 60s. He lost his brother in 82, and that formed then the entity we know today as J.W. Friend Farm started in 83, and it's been the same since. So, yep. The feed yard's grown over the years as the family's grown and come back and stuff. So, kind of started in 85 and just kind of steady growth from there. So
yeah, and so you have a combination of farming and cattle feeding enterprises.
We do, yeah. So we call it, I don't know. Doug takes care of all the crop side records for the crop side and does the spraying. We each kind of got our own little area that we make the final decision on. So,
you know, as a diversified operation and obviously a family operation, I think I've learned as much or more from y'all than y'all have ever learned from me. But this is a family operation.
It is. Yeah, absolutely. We're all involved. Everybody knows what everybody else is doing at all times during the day. I mean, that's the way it works.
Yeah.
Vinny's got to know what I'm doing as well as I know what he's doing.
Yep. And where you're located, obviously, you know, the row crop is in being able to make feed for your operations is vitally important.
Absolutely. Yeah. And to utilize the manure from the feed yard as well. It all goes back out. We don't sell any manure today, I guess, but we can utilize all the manure and what have you from the feed yard.
And you've been involved in the industry. Y'all have been, you know, U.S. premium beef to you know, you're very humble, but you've been really a player in our industry, and moving and working with people in Kansas and Texas and Nebraska and Iowa, just all across our beef industry.
Yeah, it's a collaboration. I mean, really, you can learn something from anybody. So, I mean, the friends we have in Southwest Kansas to Panhandle of Texas to Central Nebraska, I mean, it makes us better too, because you can bench yourself off some of the great players in the industry.
Right. Well, we're going to take a break, and when we come back, we're going to talk about y'all's hospital project here for your feed yard, and talk about a whole bunch more cattle feeding. We're here in Southwest Iowa. We're at J.W. Friends Farms. Thanks for joining us. We'll be right back.
Hello there, Dr. Nick Wagner, Professional Services with Neogen, and today I wanted to talk about product labels and food safety. One of the first things that you want to make sure you do with injectable products when handling is make sure that you store them properly in order for them to be effective when you go to use them. The other thing is always check expiration dates, because you don't want to use an expired product, because that could lead to concerns with efficacy of the product, could lead to concerns with reactions in the animal, or is also concerned with the regulations from the FDA's standpoint. One of the other things then, when you read that label, you want to make sure that you understand what the dose is and how you administer that product, whether it's an intramuscular injection or whether it's a sub-Q injection. Because if you're not giving the injection in the proper location or the proper tissue of the animal, it may impact the effectiveness of it, or the possibility that the body absorbs it differently and potentially could change withdrawal time. That's a concern with potential residues. And then that leads us into understanding and making sure you check the label for the withdrawal time, and then understanding what that is and making sure that it elapses before you ever consider any decisions to market that particular animal. And then one of the last things, keep records so that you know when you gave those treatments, so that again, you're able to respect that withdrawal time. But all of these things come down to making sure that we avoid any residues and we produce a safe, wholesome product for the consumer.
Thanks for watching Cattle Intel by Neogen.
Are you a cattle feeder looking to manage for a stronger and more profitable set of cattle? Look no further than Igenity Feeder. Igenity Feeder utilizes DNA to gain insight into your cattle's genomic potential, with the information to predict performance, quality, and economic endpoints for cattle feeders. Animals are scored and ranked in a simple format, driving more precise and accurate management decisions. Igenity Feeder gives you the power to predict days on feed, manage variability within lots, characterize carcass performance, and focus on metrics important to you and your operation. With the data provided, you will identify superior animals earlier and maintain high operational efficiency. Maximize your profit and optimize performance with Igenity Feeder.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey everybody, welcome back to DocTalk. I'm Dr. Dan Thompson. Thanks for joining us today. We're at J.W. Friend Farms here in Lewis, Iowa. We've been out this morning and we've doctored a few calves, and I've been waiting to, first of all, to shoot this, wait until y'all get out of school so that you'd be here when we're doing this. But it was really cool project. When did y'all do the hospital project?
Last year. We've been planning it for a while, but we built it last year. We had an older one that we were utilizing, and this one we started from pretty much from scratch on the handling side, and then we just went from there.
And it just amazes me as you walk through this hospital. There's a lot of things, and we'll talk first about the facility and cattle flow, and then we'll talk about the hospital pens and how those were made. But first things first, as you walk through the gates that you can swim cattle.
Yeah, we designed it for the safety of the animal and utmost of the guys. So we never have cattle. We always have a gate between us and the animals to keep the boys and everybody else safer. And then it's a project that we all designed, and then you helped refine it, and Dr. Kip helped refine it over time, and it just is something that everybody had a piece of to say in and add to. So it really is a team effort.
Yep. And I think that as you walk through it and you look at it, being able to swim those cattle, and it helps calm down those cattle that are wanting to come back and that are on the fight. But then when you get them to the tub, even down to the tub gate with the obviously the magnet to keep the tub gate open, that's something that y'all ought to patent right now. We just said that on national TV. So that if you do put a magnet on your gate, you got to pay a royalty to JW Friend Farms. But you walk into the tub and you get into the tub, and then the ability to walk those cattle around with that tub gate, the walkthrough of the person, the man gate to get there, and then as you walk those cattle forward, being able to then have those cattle calmly pushed into the single file.
Right. It's designed so that the cattle, you can communicate with the cattle, because if you make it tall, then they can't see you, and these guys can have their body movements to have the cattle go forward and stuff.
And our hot shot uses went down, means the cattle can see us and we can see them also.
Yep. And what I noticed too is, okay, when you look at the single file, you've got it a foot off the ground, and you've got to where two things, where the cattle can look over and communicate with the people that are handling them, and where we can easily clean out and not have contact on the ground where it's going to rust.
Right. It's easy to clean, and then it's open too, so we was worried about snow, easier to clean up everything. It's designed to not be contaminated all the time and drag your sickness around, and for it's just all kinds of benefits.
Yeah. And I think that the ease and the ability to clean it out is, they always told me if it's hard to get clean, it won't get clean.
Right.
And so focusing on making sure that that's something, and with your hose system in your tank, that obviously is another segment that you thought through to make sure that you would always have water pressure, that you'd always have plenty of ability to be able to spray that down.
Yeah, it doesn't take you guys, the boys clean it real fast and easy, and it's something that we've always seen. Like John said, if you see it in Kansas or whatever, and we don't have that kind of well system, so we had to build a tank, and we applied it to the Iowa yard, the only way we could get it done.
It's awesome. Let's take a break. When we come back, more on the hospital system here at JW Friend Farms, Lewis, Iowa. Thanks for watching DocTalk.
From the veterinary standpoint of it, we all know that stress is a precursor to a lot of other underlying diseases. The cells in the animal's body at different points can react differently to the vaccinations or whatever we're giving them. So if we can create an animal that is less stressed, 1 pound will pay for the whole cost of the therapies right now.
One animal has this huge impact on your operation.
BVDV is one of the most costly bovine diseases, with losses of $15 to $88 per head.
The virus will actually cross the placenta and get into the fetus. As it's developing, its immune system will recognize that virus as it's supposed to be here. And so then that's where our persistently infected animals come from. They're going to shed that virus their entire life, and then it's going to impact your operation.
It is important to work with your local veterinarian and partner with IDEXX for the best solution for your operation.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed Lidoband, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. Lidoband, a small device that can make a big difference.
Valley Vet Supply sees the hard work and effort of you and your animals to achieve your goal of being a champion. And we're here to help along the way. To the cowboys and cowgirls, to the dreamers, we see you.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with the JW Friend Farm Group and the Friend family. And tremendous family in agriculture. Highlight of my month is getting to come and visit and work with y'all. Special people. I'm very, very thankful.
We feel very lucky to
Oh, yeah.
work with you as well.
It's great. It's great. They probably we don't have our reality show yet, but it's coming. And but we have special families, and you know, as we look at the hospital, you know, one of the other things is moving them from that tub through the single file through the chute, right? And we put the cable on the no back.
Yep. That was your idea and Dr. Kip's.
Yeah.
And you guys were lucky enough to give it to us.
Well, I think I stole it from somebody else, but that allows that no back to raise where those cattle don't balk and they'll.
Yeah, you can really use your body to tell the cattle what to do. You don't have to talk to them and yell, and you don't have to use a hot shot near as much. And if you're patient enough, they just flow right in. As soon as you pull on that no back cable, they see the hole open, and that's when they go.
It's excellent. And then we get to the flooring, and you know, obviously we have the concrete grooves in the tub, which help with traction and keep the cattle clicking. But then we transfer into the single file onto the animat mats, and those really help with keeping cattle standing, don't they?
Yes, they do. They're shocking because they're so they're like a kind of corrugated to different heights, and you'd think they wouldn't stand there very well, but they actually really just calm down and they feel relaxed when they get on those mats, and they're easy to clean. That makes a big difference too, to use them.
Absolutely. And so the mats help with the traction. Actually helps with the cattle stopping right up against the back of the chute too, because I've seen that where if you're having a problem with cattle that aren't stopping coming up to the back of the chute, everybody's like, well, they can't see it. No, they can see it, they can't stop.
Yeah.
Because it's slick. And so that's important. And then we've got the animats as the cattle exit, right? And that helps with no slips and trips and other things for beef quality assurance.
Make it quiet rather than just on concrete, you know?
Yeah.
The animats make it quiet.
It's excellent. It's excellent. And so everything has been thought out from, you think of some simple little, well, we're going to get some cattle in the chute and doctor them, right? But as you can see, swimming the gates to the walkthrough to the moving tub where you're on the ground behind the cattle, to the cable for the no pack, to the flooring, and then when we're doctoring, obviously when we doctor those calves, you have the window put there so that you can communicate with the crew.
Yes, our communication process is always open. In our old facility, we couldn't talk as well, and it makes it a chore. If you make it fun to work them and easy to do, it's a lot better to go pull the sick cattle and treat them successfully when it's not a pain in the butt. If it's enjoyable to do, it makes it easier on you and the cattle, and you do a better job because it's not a burden. It's actually easy.
Exactly. And so those guys can get their clinical signs, whether it's the lung score that you're doing or the rectal temp that y'all were doing, communicate that through. We get a clinical definition, right? And then from there, you've got your medicine right there and the computer.
Yep, so you can enter it as they're doing it, not get off and pass through the window, and it just saves a lot of time and footstep and clarification of what you're doing. Yep. Honestly.
And we don't have to talk as loud, and the cattle stay calmer because we're closer and we're not trying to talk through a wall or anything like that.
Yep. Well, all of it goes into huge success and what we've seen with your treatments and your case fatality rate and death loss. So let's take a break. And when we come back, we're going to talk about your housing system with your hospital. We're here at JW Friend Farms, Lewis, Iowa. We're going to take a break. We'll be right back.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it, though. Go to macrosin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrosin.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idex.com/DocTalk.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here in Lewis, Iowa, and we're out at JW Friend Farms, and we're with the Friend family. And it's a family affair. It's everything from procurement to feeding to cattle handling to processing to walking the pens to taking care of sick cattle. This is just an operation that's a gem, and it's second to none. And I am very, very fortunate to be able to come here and work with these guys. And Kevin, when we designed that hospital and the pens, right, there was some thought process involved beyond just, hey, we need a place to stick some sick cattle.
Right. Well, our older one, it was smaller and we couldn't get in with big equipment to bed for the comfort of the cattle. And then with this, it's open on all four sides if you have the curtain up and both doors, so we get more airflow in there when we need it, or we can shut it all to keep them warm. And then the feed is underneath the roof, so we can, and the shade, so they can come in there whenever they need it.
Yeah, to me, getting them fed, providing enough pen space. We're giving them the same amount of pen space on concrete as what a calf that was in confinement or even more pen space is vital for cattle recovery. But then you went the extra mile. We've got both a shade, we've got a regular feed bunk, and we've got bedding.
Yeah. And 5 different pens for 5 different rations that we have, so we can have sorted that way.
So that allows you to keep the cattle based on whatever ration their home pen's on. That's what they're getting when they're in the hospital.
Yep.
So when we think about this, again, just some simple little old pens that we just want to put some calves that we treat in, but it's really not. If you want to pay attention, you want to think about the attention to detail of decreased in heat stress, decreased in cold stress, the ability to keep them on the same ration, and that gut health interaction is all vital to the recovery of these calves.
Absolutely.
Right. Then the other side of this is the ability to clean it, right?
Right. You gotta make it easy to clean so you will clean it.
Yeah. And so how did you design that?
We got pass-through gates in the drover's alley. We can swing a gate open and push with a skid loader just right into a basin, concrete basin, and it makes it easy to clean and without doing any shovel work of any kind, and which makes you clean it more often because it's easy and keeps the cattle healthier and happier, and it's just basically, if you make it easy to use, you'll use it correctly.
Yeah, a little different than before, huh?
Yeah,
a little less shovel work.
Yeah,
a lot less shovel work.
I've heard it from maybe the elder 4 a little more than the younger 6, but as we move from that, the ability to the stem walls help quite a bit too, to be able to trap that and move that. Correct?
Yeah,
correct.
And it keeps down on flies and things like that in the summer too, because there's nothing stuck underneath the fences that you didn't go shovel out or anything. It's just gone.
Yeah. And you know, when you start to think about the level of detail and the number of times going through it, I've been waiting to unveil and show people this facility, because to me it is so much thought process and so many things that are integral, so much beyond what's in the bottle or what's in the syringe, to true cattle management and husbandry.
Right. But he's blessed to have everybody's input, yours and everybody else's.
Yeah.
You know.
Well, one thing about it, we're a team.
Yep.
That's right.
That's right.
Absolutely.
We work together.
Yep.
So thank y'all for being on the show today. Thanks for letting me disrupt your day.
Thanks for coming.
Yeah.
Thanks, Doc.
Thank you for watching DocTalk. Remember, if you want to find us on the web, you can find us at www.doctalktv.com. Always work with your local veterinarian. I'm Dr. Dan Thompson, here with the JW Friend family. We're at JW Friend Farms, Lewis, Iowa.
And we'll see you down the road.
At Merck Animal Health, we support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.